Would anybody care to speculate on what the Medicare bill is for the United States well, this would come from the Department of Treasury and Office of Management Budget. Anybody like to bid first as to how much they think the United States government is spending on Medicare? And I'll start the bidding at $200 billion a year and let you take it from there. Well, well, you guys are a little bit high. It's $1.1 trillion per year. How about Medicaid? I'll start it at $400 billion.
800 billion. 800 million.
No, you're almost there. It's $900 billion. Now you're at $2 trillion for the tab, for medical services in the United States. One thing you should know about this, inside of it, as far as orthopedic procedures for the United States, for people who are 65 years of age and older, it constitutes 17% of the population, but they consume 55% of all ortho care. That's for fractures, that's for trauma, that's for injuries. You've got arthritis in there, but it's not just the surgeries. It's medication, it's physical therapy, it's prosthesis, it's walkers, it's canes. This is just a slice of obviously what Medicare is going for. And then there's workman's comp, which involves time lost for people that are out of work. Anybody care to speculate on what that's running us a year?
$2 billion.
Well, no, it's a lot less than what you might think, but it's still too much. It's $163 billion a year. Now, the federal deficit, the spending for the federal budget is a bit over this projected one for this fiscal year, whenever it starts, is approximately $7 trillion. Okay, revenues coming in are speculated to be approximately $5 trillion. That means that the deficit is just about over $2 trillion, which is equal to our health care bill. Okay, that's a lot. That's one place to start thinking about this. And I have some familiarity with the science, the physics, and the biochemistry that you've been talking about. And I've seen and heard the results from people who've actually been at the receiving end of resonating with the theory, with the machines. And I'm sure that this technology could avoid a lot of expenses and unnecessary invasive procedures, MRI, CT scans. Not that we're against diagnostics, but I think it's overused. Medications and all other complications, not to mention addiction to painkillers. And I think now that we have a new group of sheriffs in town, including RFK Jr. and Dr. Oz, who, if I understand correctly, have had direct personal experience with the modality, that one of the answers that could help our spending, the most important thing, is when all else fails, is to look at the patient, is to help patients, help recovery, and help their quality of life. Not that health is not just the absence of disease, it's the positive presence of growth and energy and development of your potential. But I think this could make a considerable difference for us. And so one of my big objectives, one of the things I'd like to see happen, is the inclusion for expenses for the apparatus, for the technology under Medicare, and also to be made available for Medicaid. Another thing, one last thing that we haven't had a chance to talk about much is the pediatric approach with the technology for children. And obviously you're talking about infancy up to 17 years of age. That there's a lot of, and not to mention stress and psychiatric applications, but I'll stop there.